Frontline health workers are being encouraged to recognise and respond to depression during pregnancy. The mental health organisation BeyondBlue will provide primary healthcare workers with information. It's designed to help them detect and discuss depression, anxiety and other mental health problems with pregnant women and new mothers. BeyondBlue says it's not normal to be depressed during pregnancy, but its research shows almost 40% of those surveyed thought it was. The program includes an online training program for health workers. And to discuss this initiative and the work of BeyondBlue, I'm joined from Melbourne by the organisation's Deputy Chief Executive, Dr Nicole Highet. Nicole Highet, thank you for joining us. Tell us about this particular program, because BeyondBlue is well known for its depression initiatives. What's different about this particular campaign?
Well, this program really focuses on women and babies. So this is really looking at the earliest years of life when a woman is pregnant. We know that mental health problems like depression and anxiety can have a significant impact on the fetus as well as the newborn baby if a woman is experiencing depression or anxiety at this time. So the aim of this initiative is really around looking at how we can identify those conditions as soon as possible and make sure those women are getting the treatment they need as early as possible, so we can reduce the effects of these disorders not only on the mother but also on the unborn child or new baby and other family members.
We hear a lot about postnatal depression. What are the rates of depression during pregnancy?
That's a great question. Certainly we know that up to 1 in 10 women will experience depression during pregnancy, and those women are likely to continue to experience depression in the postnatal period. So 1 in 10, so 10% during pregnancy, and then this increases to 16% in the postnatal period. So this is Australian statistics, and these statistics show how common these conditions are and why it's so important that we have universal routine screening to detect and manage these conditions as early as possible.
Now, organisations like yours go around surveying people about their perceptions and thoughts about conditions like depression and anxiety. What are you finding?
Well, as just mentioned, it's always interesting just to know what the community perceives and how they understand conditions like depression and anxiety. And concerningly, a high proportion of women perceive that it's actually normal to feel depression during pregnancy. Now, this tells us that quite often the signs and symptoms of depression or anxiety are confused with other signs of fatigue or tiredness, which may be commonly experienced during pregnancy. And as a result of that, people are unlikely to raise it with their healthcare professional or seek help early if they are just putting these symptoms down to just part of having a baby or part of being pregnant. And ultimately the concern there is that these conditions will persist and potentially get worse, whereas we could intervene early if women were more aware about what to expect and what to look out for, and when they've crossed the line of it being something more serious like depression or anxiety.
How much is the onus on the medical profession then in a pregnancy to screen for things like depression, where they would normally screen, sort of for iron levels and for diabetes and that sort of thing?
Look, we think primary healthcare professionals are they're actually at the front line, so they're in a really important place to really identify these conditions early. And as you say, it is no different than screening for other physiological conditions, which we do routinely without question, given that these conditions are so common and also have such detrimental effects if they're not detected early. Health professionals have a key role to play in terms of knowing how to have that conversation with the woman and also knowing how to screen, and if a person is indicating possible signs of depression or anxiety, knowing how to then refer or provide appropriate evidence-based treatment is what we're looking for health professionals to be able to provide through these resources and the online training programs and guidelines.
And how is the medical profession performing that task at the moment? Do you think it's adequate? Do they have the resources that they need?
Look, certainly part of the launch today, the new resources, is about equipping the health professionals with these resources. This is a considerable amount of activity that's been going on for the last 4 years since the Commonwealth Government's investment into the National Perinatal Depression Initiative, and this is leading to routine screening being implemented across Australia. Certainly some states are at different points of that at a routine level, but certainly significant progress has been made in the postnatal period, and now it is extending into the antenatal period as well. Right. But in order to make it universal, we need to equip the health professionals with these resources, which is what this is about today.
Right, good on you. Dr Nicole Highet from BeyondBlue, thank you for talking to us.
Thanks for the opportunity.